Hello, everyone. Welcome to the first collaborative touchless Narcan training event hosted by the Ninth Circuit Solicitor's Office for Charleston and Berkeley counties, Wake Up Carolina, the Moncks Corner Police Department, and the Ernest E. Kennedy Center. My name is Nate Lyles, and I'm the Program Director at Wake Up Carolina, a recovery community organization located in Mount Pleasant that provides education, awareness, and hope through recovery to individuals and families affected by substance use disorder.
To give you kind of an idea of the scope of the opioid epidemic, it's really important to kind of look at the epidemic on a national scale first and foremost. And then what we're going to do is kind of break it down what we're seeing across the state of South Carolina. And then also even go a little bit further and break it down to what's happening not only on a statewide level, but here in the Low Country. So, to give you kind of an idea of the scope of the opioid crisis or the opioid epidemic in the United States, this would be like 9/11 happening every 3 weeks. This would be like the sinking of the Titanic every 11 days. This would be like the attack of Pearl Harbor every 17 days. This would be like Hurricane Katrina occurring every 13 days. This would also be like the crash of a full jetliner every 3 days. And last but not least, this would be like the number of Americans that die from workplace injuries in a year every 41 days. This is a graph of the United States in 2003 depicting the drug overdose deaths per 100,000 people for opioid overdoses. As you can tell, the less red areas shows less overdoses as compared to other parts of the country with more potent red areas. So what we're seeing is in this graph of 2003, a little bit of more red areas on the West Coast, and then also around the area of West Virginia. Now let's take a look at a 2017 graph of the United States. In comparison to the 2003 graph that I showed in my previous slide, you'll notice that the amounts of overdoses across the United States almost skyrocketed. So you're seeing larger populations or populations of red counties across the United States being affected by the opioid epidemic. These depict numbers of increased overdoses, so higher concentrations of darker red actually show areas of the United States that are hit hard or harder than others by the opioid epidemic. Another breakdown of the effect of the opioid epidemic on a national scale can be kind of viewed through this chart. And what I would like to kind of point out is from the years of 2006 to the years of 2018, I'd like to first note the total number of prescriptions of opioid-specific prescriptions that were prescribed in the United States. So from the year 2006 to the year 2012, the total number of opioid prescriptions written started in 2006 at around 216 million prescriptions. And then we found ourselves as a country in 2012 having a total number of opioid prescriptions prescribed in the United States skyrocketing to 255 million. So that we saw an increase of 50 million prescriptions of opioids written. So since 2012 to the year 2018, we have seen lowered numbers of prescriptions being dispensed on a national level, but we are still seeing heightened levels of overdoses that are direct results of overdoses to opioids specifically in the U.S. As it is very important to look at the opioid epidemic on a national scale here in the United States, it's also really important to bring in the scope of focus to not only South Carolina, but what's happening in our own communities. So this data depicts suspected overdoses related to opioids in 2020 of June. To give you kind of an idea of the scope of what's going on with overdoses, but also the scope of how COVID has infected these overdoses, in June 2019, this month in time, there were 527 reported suspected overdoses directly related to opioids. In June 2020, just 1 year later, all suspected overdoses related to opioids was almost doubled to 900. You'll see on the right-hand side the top 10 counties by count for suspected opioid overdoses. Horry County tops the list, however, Charleston County is second. And you'll also see the top 10 counties by rate per 1,000 residents in the bottom right-hand corner. So it's really important for all of the attendees of this event to understand that not only are we as an organization and our partnerships and our community trying to enact change and action in our communities, but it's really important to understand that you are being part of the solution and also part of the solution of what we can do in the state of South Carolina to combat this silent hurt. I'd like to take a moment to discuss newly enacted legislation in the state of South Carolina that has positively contributed not only to the protections surrounding the administration of naloxone, but also to the reporting process surrounding suspected opioid overdoses. In 2017, the state of South Carolina enacted the Good Samaritan Law, which essentially does two things. First and foremost, it protects a caregiver who gives naloxone to a person whom the caregiver believes in good faith is experiencing an opioid overdose from civil or criminal liability. In addition, this law provides criminal immunity to a person who calls the police or EMS to assist someone who is overdosing. So, for example, folks who may be nervous or wary from administering Narcan out of the concern that they would cause the individual overdosing further health damage were protected. In addition to this, the Good Samaritan Law also protects individuals who are engaging in possible criminal activity that leads to an overdose for a potential overdose. For example, folks were overdosing and being dropped off many times in hospital emergency rooms. Folks were also overdosing and not calling for EMS or 911 out of fear of being prosecuted. In these cases, the Good Samaritan Law actually protects individuals. It's important to know that the terms opiate and opioid tend to be used interchangeably. But just to kind of give you an idea of what we're talking about when we reference opiates or opioids, let's look at some examples. First and foremost, we have opium. Second, we have heroin. And then that leads us into other forms of opioids, more synthetic opioids that are typically prescribed after typical medical surgeries in the forms of morphine, oxycodone, methadone, hydrocodone, and codeine, just to name a few. So to give a continued overview of what opioids include illegal drugs such as heroin, but they also include prescription medications that are used to typically treat pain. And these could include Percocets and Oxycontin. And how they work is they bind to specific receptors in the brain, the spinal cord, and the gastrointestinal tract, which minimize the perception of and reaction to pain. They also stimulate the reward center in the brain, and they also affect other systems that regulate mood, breathing, and blood pressure. So what essentially happens is you take a opioid and you essentially feel better. Your reward centers are rewarded, and you have this euphoric feeling. And the best way that I can give kind of an overview of opioids with this picture is kind of think of your brain having these little screw-like apparatuses in your brain. And what happens when you take an opioid is the opioid comes into your system and they fit directly and exactly on these opioid receptors. And as they sit there, your reward centers are pleasured. You experience euphoria, you experience less stress, you experience kind of a really good feeling. So let's take a moment for clarification purposes, just to make sure that we all understand what opioids are and what opioids are not. Opioids do include heroin, morphine, methadone, oxycontin, oxycodone, hydrocodone, and hydromorphine, as well as fentanyl. Opioids do not include cocaine or crack, methamphetamines, benzodiazepines, Seroquel, Neurontin, your muscle relaxers, or alcohol. In deciphering what opioids are and what opioids are not, often overdoses involve one or more of the drugs on the right-hand side in combination with opioids. So it's important that naloxone should still be administered in these cases. At this time, I'd kind of like to go into how an overdose occurs in the first place. So first and foremost, one possibility would be a deliberate misuse of a prescription opioid or illicit drug like heroin. Heroin on the market today is extremely inexpensive, yet so pure it can be snorted. What we are seeing also is synthetic forms of fentanyl being mixed into heroin that is then snorted or injected. Both forms of administration can be deadly. Another form of overdose can occur by taking meds originally prescribed for someone else. So let's say a friend or family member goes into surgery. They leave with a prescription of opioids. They get through the initial 72 hours of pain management and decide not to take the rest of them. And so sometimes what we do see is the deliberate use of someone else's medication. What we're also seeing is a dosing error. This can be from a prescriber, a pharmacist, or a patient's misunderstanding of directions for use. So let's say that, and I always like to steal a colleague of mine's description of this, is that you have your pill box for the week, and you every Sunday you deliberately put what pills you take in the morning and what pills you take in the evening, and you kind of allocate them out for the week. And sometimes you might have forgotten if you took that one blue pill that morning, or you can't remember if you took it, or maybe you thought you were supposed to take it in the evening. So let's just say you double up. Sometimes we're seeing a dosing error, which actually leads to an overdose. But we're also seeing overdoses occur when mixing opioids with alcohol or certain other medications. These can even be over-the-counter meds. So sometimes folks are on a prescribed amount of opioids for whatever reason, and they, let's just say they take in a glass of wine or a couple of other alcoholic beverages. This can actually contribute to an overdose based on the amount of alcohol that's consumed in combination with the dosing of opioids at hand. So now that we've discussed how an overdose from opioids occurs in the first place, it's important to understand who is at risk. So the main categories of those that are at risk include persons who are using opioids for long-term cancer management, individuals who may be undergoing cancer pain management, and specifically in regard to heroin, who is at risk mainly pertains to a variation in strength purity of street drugs or lack of knowledge of dosage or the strength of the pharmaceuticals. Individuals who are switching mode of administration, as well as inexperienced or new users. And I'd like to kind of break that down for a moment. So in regard to heroin specifically, folks that purchase heroin off the street and those that are experiencing overdoses, we are seeing that folks don't always know what they're purchasing. So a dealer or a source that someone might have used in the past to purchase heroin might not be the same chemical makeup to what they're used to. We're also seeing, and we'll go into this in our next slides, the addition of fentanyl into a lot of heroin. And so fentanyl, what we'll get into, is actually more lethal than heroin itself, but we're seeing that laced in a lot of the heroin on the street. Another instance, like I said, is switching the mode of administration. So this could include individuals that began by just taking pills or eating pills that ended up snorting, and then snorting to injecting heroin. And then also another category, like I said, is inexperienced or new users to heroin use. So individuals that might think just because, the person they're using with can intake a certain amount, that might not be an amount that their body can withstand. So we're seeing overdoses occur as a direct result of that as well. Other populations who are also at risk of an opioid overdose are individuals who are receiving rotating opioid medication regimens, individuals who are discharged from emergency medical care following opioid overdose or poisoning, individuals with a lower tolerance, so this could include individuals completing mandatory or voluntary detox or abstinence-only treatment programs, past users or abusers of opioids and recently released from incarceration, or individuals that are mixing various drugs such as opioids and benzodiazepines. A final population that this includes are individuals with poor physical health on the general level, so folks with liver damage, asthma, or possibly In my previous slides, I referenced fentanyl a couple different times, and fentanyl is a synthetic opioid that we're seeing at an increased level of inclusion in street drugs such as heroin. So on the left-hand side, you'll see a penny, and then on the right-hand side, just to kind of give you an idea of how much fentanyl is considered to be a lethal dose, the right-hand side shows a lethal dose of fentanyl. So we've talked about how an overdose occurs in the first place, and populations of individuals who might be at risk. But let's go a little bit deeper on how an actual opioid overdose occurs and how to respond. You will actually be leaving our presentation and our event with 2 4-milligram nasal Narcan sprays, as you can see in the top right-hand corner of this graph. First and foremost, how the overdose actually occurs. So there's 5 different kind of steps to how an opioid overdose occurs, and I'd like to break them down for everyone. So first and foremost, there's a slow breathing process. Your breathing starts to shallow. The amount of breaths that are taken in minute by minute start to drastically decrease. Second thing that happens is your breathing stops. So your breathing has slowed so much that you actually stop breathing altogether. The third part is the lack of oxygen causes brain damage. So basically, because you've stopped breathing, your brain starts to shut down. And what this leads to is your brain essentially says to your heart that it no longer needs to beat, and then ultimately death can occur. Again, your brain stops signaling the lungs to breathe, so your oxygen levels decrease and carbon dioxide levels increase. And death from an opioid overdose typically occurs 5 to 6 minutes after breathing ends. So it's also important to note that the process can take 1 to 3 hours, so there is time to intervene, but no time to waste. So to go into how naloxone actually works when administered, first and foremost, the opioids attach, like I said earlier, to the brain receptors that minimizes pain, but that also affects breathing. Naloxone reverses the effects of opioids by binding more strongly to the same receptors and temporarily taking over, and knocking the drug off these sites that breathing can be restored. This only works on opioids. Naloxone will not reverse any other overdose that a person might be experiencing. It does not work for overdoses caused by substances such as cocaine, amphetamines, ecstasy, GHB, or alcohol. However, it does not also have the potential for abuse and does not increase risk-taking behavior. This cannot be used to get anyone high and is not addictive. So like I said earlier in this presentation, a lot of times folks that are unfamiliar to naloxone or Narcan think that it's a addictive substance, and so therefore they are scared to administer it. It's also important to note that individuals that are experiencing an overdose to opioids, being administered naloxone simply gives them a life-saving chance of reversing the overdose, but also hopefully finding recovery after the overdose has been reversed. In addition to this, it has a long safety history, and reported side effects are very, very rare, and it can be easily and safely administered by laypersons. I'd like to take this time to discuss the 5 essential steps for lay first responders who will be equipped with 2 4-milligram Narcans after this presentation today. Step 1 is to check for signs of an opioid overdose. These include checking to see if the individual is unresponsive to shouting or pain stimulation, otherwise known as a sternum rub, or the inability to wake them. There could be problem breathing, so deep snoring, wheezing, or gurgling, also referred to as the death rattle. The individual could have blued or purpled or grayed face, especially around the lips and the fingernails. They could also be pale, have clammy skin, or a loss of color. And they also could have pinpoint pupils. There also could be the existence of slowed heartbeat and or low blood pressure. On the flip side, there are also signs of overmedication, which may progress to overdose. These include unusual sleepiness, drowsiness despite loud or verbal stimuli or sternal rub, mental confusion, slurred speech, or intoxicated behavior, slow or shallow breathing, slowed heartbeat and or low blood pressure, or there could be a difficulty waking the person from sleep. So as previously mentioned in the last slide, these are some images of cyanosis, so the blued fingernails or blued lips. So you want to inspect the individual's nail beds to see if there's any blue discoloration, as well as the area around their mouth to see if there's any blue there as well. Also previously referenced is a response to pain stimuli. So what you want to do is also administer what's known as the sternal rub. And what the administrator does is takes their fist and balls it up into a fist and holds their knuckles on the person's sternum. And if you'll actually do this while you're participating in this presentation, you'll notice that the harder you press on your sternum, the harder it hurts. So if a person is not responsive to that, this could possibly lead to one to think that that person is experiencing an overdose to opioids. Step 2 requires that you support the person's breathing. So what you want to look at is to see if the person is not breathing. You want to provide rescue breathing that could make a life-saving difference. This is because even after you administer Narcan, it may take several moments or minutes for them to awaken. So these very important steps include checking the individual's airway to make sure it's cleared. So you basically want to make sure that there's nothing inside the person's mouth or throat that's causing a blockage. Secondly, you want to place one hand on the person's chin, tilt the head back, and also pinch the nose closed. After you've done these 2 steps, what you want to do afterwards is place your mouth over the person's mouth to make a seal and give 2 slow breaths. If you're doing this correctly, the person's chest should rise, but not the stomach area. So make sure that their chest is rising, but not their stomach. Rescue breathing should be administered when a person is exhibiting a death rattle, an exhaled breath with a very distinct labored sound coming from the throat. Emergency resuscitation will be necessary immediately, as it almost always is a sign that the individual is near death. So what, again, you want to do is make sure that you use one hand to tilt the individual's head back. You want to use another hand to cause a blockage in the nose. And then what you want to do is administer 2 rescue-saving breaths, making sure that the individual's chest rises but their stomach does not. Step 3 is very important, and it involves dialing 911 immediately. So first and foremost, it is important that medical expertise can be there for the patient as soon as it is possible. If someone else is also on the scene with the first responder, have them dial 911 while you administer Narcan. So for example, say someone is unresponsive and not breathing, ask them to bring Narcan with them. Also be sure to give an exact address or location, as well as the description of the location where you are administering Narcan. Step 4 includes the administration of naloxone or Narcan. So each participant today will leave with 2 4-milligram Narcan units per box. It's important to also note that it may take the administration of more than 1 unit to revive an individual. Please note that it's also safe to administer to pregnant women in cases where a suspected overdose is occurring. It might be helpful to note that the administration of Narcan or naloxone is very much like any other nasal spray that can be found over the counter. So the first thing you want to do is actually take out the Narcan nasal spray from the packaging. Step 2, you want to hold 2 of your fingers over the top with your thumb on the plunger area. Step 3, you want to administer 1 of the 4-milligram sprays into 1 nostril and spray all the way up. In the event that you need to administer a second or third or even a 4th Narcan spray, please be sure to rotate between nostrils. Step 5 is the final step, and what you want to do is monitor the person's response. So for example, spontaneous breathing usually begins within 3 to 5 minutes of the naloxone administration. Rescue breathing should continue while waiting for the naloxone or Narcan to take effect. Naloxone only continues to work for 30 to 90 minutes, and an overdose symptoms may return. So in this, it's important that the person gets to the emergency department as soon as possible after they have been revived. All patients should be monitored for occurrence of signs and symptoms of opioid toxicity for at least 4 hours for the last dose of naloxone. So one example that I like to give too is that sometimes a person's response may include the appearance that they're coming out of the overdose, and that's the goal. However, there is the possibility for re-overdose, so you want to make sure that 911, like is said in step 3, is on the way so that once they are there, they can be taken over by medical professionals to make sure a re-overdose doesn't occur. After the administration of Narcan or naloxone, you want to place the person in the recovery position. So, first and foremost, if a person is breathing, please turn them or the person onto their side as seen as the picture below. The position will prevent the person from potentially inhaling vomit. So, as the reaction to being administered Narcan can be a little bit unpredictable, what you want to make sure, like I said, is to make sure that the individual does not have a blocked airway from inhaling any vomit potentially. And it's also important to discuss what happens post Narcan. So, an individual who has been Narcan might exhibit withdrawal symptoms, and these include everyone wakes up from an overdose slightly different. There could be violent reactions associated to the naloxone, even though these are rare. Most people are disoriented and may not realize that they have even been overdosed. So sometimes folks come out of an overdose reversal very confused, very hazy, kind of questioning what has occurred, and you're the first person that they possibly are looking at. In this case, you want to try to explain very, very calmly and compassionately to them what has happened, and make sure that the individual does not try to ingest any more of any drug while you're waiting for EMS to arrive. I'd like to take some time to discuss the important manufacturer storage instructions surrounding Narcan storage. First and foremost, it's important to always carry naloxone nasal spray with you in the event that you do need to administer it. However, we ask that you try to leave it not in a hot car or hot location. It's important to realize that if you do need to administer Narcan and it has been stored in a hot area, it is absolutely safe to go ahead and administer the Narcan that's been there. We want to make sure folks understand that just because it has been in a hot location for prolonged periods of time, it is not harmful to administer, but we just ask for best practices that you keep it in a cool environment. You do not need to store your Narcan in a freezer or refrigerator. We ask that you also store Narcan in a locked cabinet or out of reach of children or pets. And this is not because it's harmful or habit forming in any way, but we want to make sure that the Narcan is readily available and accessible in the event that you do need to administer the Narcan to an individual. In order to recap what we've discussed today, I'd like to reiterate some do's and don'ts in responding to an opioid overdose. First and foremost, you do want to support the person's breathing by administering oxygen or performing rescue breathing. And also make sure to administer the naloxone that you have on hand. Just as a reminder, if you do need to administer multiple doses of Narcan, please go ahead and do so. It's not harmful or habit forming, but make sure that you rotate between nostrils in doing so. Make sure that you put the person in the recovery position on their side if he or she is breathing independently. What you also want to make sure you do is stay with the person and keep him or her warm until EMS arrives on scene. Some don'ts include slapping or trying to forcefully stimulate the person. It may cause further injury. If the individual does not respond to a sternum rub or light pinching, they may be unconscious. What you also do not want to do is put the person in a cold bath or shower. They may fall, drown, or get into shock. And you also want to make sure that you do not inject the person with any substance. So salt water, milk, speed, heroin, or any other form of drug. Also, it's important to remember that you don't try to make the person vomit drugs that he or she may have swallowed. Choking may cause an inhalation of vomit into the lungs, which can also be fatal. I'd like to thank you all for participating in today's Narcan demonstration. For more information, please feel free to visit Narcan.com or contact myself or Nancy Shipman at Wake Up Carolina directly through our contact information below. By equipping community members like you with this life-saving overdose reversal drug, we are all making great strides in reducing the number of overdoses that occur in our community. Remember, hope and recovery exists.